my name is Mashkevich and I am a facial, plastic and reconstructive surgeon at Specialty Aesthetic Surgery. And today I'd like to talk to you about changes in the neck that happen with aging. Aging changes happen for everyone at a different point in their lives, and it's not a linear curve. In some people, they don't really age for a long time, and then something happens, whether it's a stressful scenario, or whether they're genetically programmed to age. All of a sudden, things drop. When people age, the muscular sling under the chin relaxes, extra fatty tissue shows up, bands show up, the skin itself can become wrinkly and noticeable from all these different angles. What we try to do with surgical correction is to address every single one of these items and create a much more pleasing, youthful, and natural appearance. Addressing the aging neck is like peeling an onion. There are multiple layers to look at. First, we make an incision that's strategic and is very difficult to see once it heals. There's a small incision under the chin and 2 incisions around both ears. Once we peel away the skin, we look at how much fat is present and we gently contour this. The key there is to create a natural contour. We do not take out all the fat. We leave a fine, nice layer on the skin so that at the end of the day, these contours are beautiful and natural. We then look at the muscular sling. I'm sure you've seen people with turkey necks where you've got these lines running down. These lines are muscle edges that over time separate, and in order to recreate that youthful contour, these muscle edges need to be restitched together. And we call this process corset platysmaplasty. It's a technical term for basically creating that trampoline that used to be there years ago. But in addition, what we also do is we look under that platysma muscle. And that particular deep plane also features a couple of items that require correction. There's fat, there's muscle. And if we see that that contributes to a bulgy neck, especially when someone looks down, it is fairly easy to tighten the skin with someone sitting in a neutral position. However, when that neck goes down, we would love to get a beautiful contour, and that requires working under the platysma muscle. That area contains additional muscles and fat, and if those get contoured, you can get incredible results, almost magical. So this particular patient displays all the signs of aging that we see in the neck area over time. There's fullness, there are changes in the skin itself, you see jowling, you see some fatty tissue, and most importantly, you don't see that nice tight sling around the neck. And we can do a magical job by making a couple of really well-concealed incisions. One goes under the chin, the others go around both ears, and we can uncover this beautiful neck contour that used to exist there, which is still there, and this is an incredible transition back in time that's going to be absolutely long-lasting.